So the voice box and the vocal cords are called the larynx. So laryngitis is just inflammation of the larynx. So it's inflammation and swelling of the vocal cords. The vocal cords are a very finely tuned instrument that helps with our voice, and it helps with the different frequencies and pitches, and the tissue on the vocal cords have a very smooth wave, so it allows us to have different fluctuations, melodious sound. Professional singers, it's very fine-tuned is how they can go. So when you have inflammation or swelling on the tissues of the larynx, it disrupts the normal function of the larynx, and the voice gets very hoarse or very breathy. There are different things that can cause laryngitis. The most common is what we've all experienced is a cold. Most typically it's viral, sometimes it can be bacterial, but you get some inflammation on there and you get a temporary loss of voice and hoarseness. For chronic hoarseness, it's very common to have reflux disease causing it. There's something called laryngopharyngeal reflux, larynx being the voice box, pharynx being the throat. And if any acid from the stomach gets all the way up to the vocal cords, it will irritate the vocal cords. And people will typically present with intermittent hoarseness or raspy voice that comes and goes, cracking of their voice. They may have a sensation like something stuck in the back of their throat when they swallow or eat, and that usually is related to reflux. So sometimes reflux precautions, elevating your head of bed, not eating within 3 hours of bed, avoiding very spicy foods, and sometimes some reflux medications helps with that. Avoiding alcohol, tobacco, caffeine, those will all make the reflux a little bit worse. Definitely laryngitis can be, or the changes in your voice can be a sign of something more severe, like cancer of the larynx, polyps, vocal cord nodules and things. And that's where we do an exam in the office, and we actually look at the vocal cords to make sure that there's nothing on them, there's nothing concerning from there. So laryngitis can be something as simple as a cold we get and we lose our voice, and that's just the swelling related to the cold, which will resolve on time, to something more serious like cancer. So that's why we evaluate and look and make sure that it's nothing serious that we need to address and take care of.